Welcome to Healthcare du Jour, where we dish up and digest the latest in healthcare. For the next 30 minutes, sit back as we bring you insight, commentary, and discussion on trending topics to the table, all expertly served up by our host and his guests. Healthcare du Jour is brought to you by High Tech Answers and Healthcare Now Radio, part of the Answers Media Network, and is sponsored by the law offices of Myrick O'Connell. Now here is your host, Matt Fisher.
Welcome back, and thank you for joining as we dive into the hottest topics in healthcare. I'm your host, Matt Fisher. On the menu today is Vanessa Kuhn, Policy Director at PatientPing. Welcome, Vanessa.
Hi, Matt. It's great to be here. Great to speak with you today.
And no, it's great to have you on. And before we kind of dive into the main body of our discussion, can you just give everyone a little bit of background as to who you are and what you do?
Yeah, I would be happy to. I'm the Director of Operations at PatientPing. I currently wear a little bit of a dual hat. Honestly, I'm the Regulatory Reimbursement and Policy Principal, and also manage our Southwest region. So meaning I'm responsible for customer and market success out in the Southwest of the country. Before PatientPing, I worked at the Innovation Center at CMS for about 3 years and primarily focused on the Pioneer ACO model while I was at CMMI. And just, I guess, to round it out, before then, I was also working at a Baltimore health system, setting up their physician network, and also had several years at the Behavioral Health Systems of Baltimore, implementing the buprenorphine initiative for the city. So really, I guess, lots of healthcare experience and long kind of track record in healthcare.
You know, kind of as you just said, a long kind of experience in healthcare. So were you always interested in getting into the healthcare field, or was that just kind of a happy happenstance?
Yeah, so I think a lot of people have kind of this very memorable moment that got them into healthcare. I honestly didn't have kind of that one defining moment in life, but I've just always been interested, I think, just in health, really biology in high school and medicine, and really probably got hooked more so when I, back in high school as a freshman, I started being a candy striper and nurse extender at our local hospital, Mary Black Hospital in Spartanburg, South Carolina. So I did that for 4 years and really got interested from there on out to want to be a provider. So I really did what a lot of other people do, right? Do all of the pre-med things in college and kind of wanted to go into medicine. But along the way, I took a lot of classes in bioethics, policy, public health, which I found really incredibly interesting and impactful just from a population perspective. And I rethought kind of my path and really wanted to pursue a career more so focused on public health and policy, because to me, in the end, like I thought it would give me just a bigger opportunity for impact and making a positive change on a population level. And I ended up getting a PhD, and really that has set my path. So like I said, not really one defining moment, but just always had an interest in healthcare. Just needed to kind of find the field and the angle that I wanted to pursue.
Yeah, no, and I think it's fair not to have a defining moment. I think it's kind of having a natural progression that isn't necessarily intentional. To me, that's always the best way to go about doing it. And again, that's kind of just my opinion on it, but it's a kind of, it allows you to really develop your interests and pursue what you find interesting.
For sure.
So, I want to kind of pivot back, though, to something you said in terms of one of your many hats that you're wearing in your current role, which was reimbursement and compliance. So when you're talking about those two, from my perspective on the legal side of things, there is a lot of synergy between those, since non-compliance can lead to reimbursement issues or not following the rules in terms of how you go about seeking reimbursement can be, obviously a compliance issue and lead to broader issues. So kind of what areas do you focus on within those pretty broad topic areas?
Yeah, so I primarily just focus on different reimbursement models, whether that's on accountable care organization rules and sort of the regulatory updates that are happening, bundle payments, just these different value-based models that have been coming out from CMS and how they impact the provider landscape, the level of coordination that's sort of required to be successful within those models. And that's really what we focus on at PatientPing, trying to ensure that we can support providers in providing really the care and having the tools that they need to make really impactful and sort of good clinical decisions and allow them to have the data that they need for really taking action at the right time and intervening and identifying patients early. So I focus really with my hat at PatientPing on kind of those models, see what kind of incentives and what kind of requirements are there for providers, and try to help kind of provide that data to our customers and kind of to the providers that we work with so that they can be successful.
So would you be able to dive a little bit more into kind of the setup of the models, and probably mostly focusing, I guess, on the ACOs, since as you were describing, you have both the background from having established them within CMMI, and now being on the outside of actually helping the organizations working within the models. Because I think there's so much development still within that realm, and now seeing a lot of flux in terms of where the regulations might be going in terms of the parameters of the program, that I think it's important to understand. I think it'll be important to understand and get your insight in terms of how do you go about establishing a network and the data to actually be able to try and succeed.
Yeah, that's a great question, Matt. And all of these models are evolving. The new Medicare Shared Savings Program proposed rule just came out a little while ago, kind of trying to change the parameters a little bit, really pushing ACOs into more financial risk sooner, and requiring kind of additional reporting and perhaps looking at additional quality metrics as well to be part of that model. So in terms of just the setup and the data, that's being used, as you know, and I'm sure many of your listeners know, ACOs can be a network of providers that either include a hospital or just, physician group. And what kind of my experience has been in terms of figuring out how to set that up is to really kind of use data to drive, one, the network that you have, but also to get a very good understanding of the patients and the population that you're trying to manage. You'll be held to managing the total cost of care for those patients, ideally achieving shared savings, of course, and also at the same time, making sure that you provide the types of services that will result in patients doing really well, having great outcomes, being healthy. And to do that, you need information about your patients, like how are they falling along kind of the risk continuum, how complex are they, and trying to set up, different data systems to help you, not just with the retrospective analysis of that, but like as you continue managing those patients in real time, knowing kind of what's going on with those patients at any given point in time, so you can deploy interventions to really make sure that they don't have unnecessary services, don't have those avoidable readmissions, don't duplicate the services that they might not need. So what you want is to set up these systems, based on data, and then also structurally with your staffing and the infrastructure that you have in place to have the right types of people, whether that's a care coordination team, population health analytics team, to really understand and be able to use the data that you do get on the patients to make that impact and to make sure that patients can achieve those really good outcomes while still, kind of doing really well on the cost aspect of it. So I hope that answers your question, but definitely, happy to clarify anything I've said.
Oh, no, certainly. It's kind of I think as your answer is showing, there's a lot of complexity to it. And also I suspect a lot of different means of trying to get to the end goal of, achieving higher quality, more efficient care. But, even though there might be, or not might be, but there certainly are many different paths that can be followed, do you have any kind of common sets of elements or factors that would be an indicator of a group that's going down the road for success as opposed to maybe not being able to meet their goals?
I mean, I think just the great indicator is, and sort of trying to enable success, is just honestly having the information that you need to drive the impact. And by information, that's data that's coming in real time. It doesn't really help you to get claims information, 6 months or 3 months after the fact, because it's not necessarily a way to really drive, transitions of care in real time. So I think those that are successful and those that are really trying to make an impact, both, financially and on the quality side, have just a lot of focus on data, predictive analytics, population health kind of strategies that they have deployed and are using within their system and across the provider setting. They're also forming new collaborations across care settings. It's really important to not just be kind of siloed into your own, hospital or health system, because in the end, you want to manage the patient's care across all of the settings. So having new partnerships, with both more traditional and non-traditional providers in the community is important. So by traditional, I sort of mean, skilled nursing facilities, home health agencies, kind of true healthcare providers. So setting up those partnerships so you can manage the care transitions, have good communication and collaboration across those settings. But then also, focusing on some of the social determinants of health that perhaps some non-traditional partners can help you address, whether that's transportation or meals or other wraparound services, and setting up those partnerships to supplement kind of everything else that you're doing, and using kind of the information that you get through the data, and, through your kind of day-to-day, clinical interactions to help supplement that with those partnerships, I think it's really critical for success.
Yeah, as you're describing, trying to get all these different providers or segments of the industry to work together that maybe have not been incentivized to or just have been at odds with each other. What it really sounds like you're describing is creating an atmosphere of collaboration within all of healthcare.
Absolutely. I think, Matt, you hit it kind of nail right on its head. I think there's just a drive towards much more collaboration. I mean, the incentives financially are set up to encourage collaboration. And I think that was or is, an ongoing, really critical pathway to change the delivery system is to, have these different payment and financial models in place that incentivize and encourage the collaboration, because you need that in the end to really manage the patient's care most successfully. So these collaborations have definitely increased a lot. People are getting very creative. They're finding each other. They know through data where their patients are going. So it makes sense to work with that provider or to partner with them and set up, whether it's preferred networks or just kind of collaboratives, and work across those different settings and across those different provider types to really manage patients' care and work with each other.
For those of you just joining, I'm talking with Vanessa Kuhn from PatientPing, and we've been talking about accountable care organizations and now just starting to get into the collaboration within the industry, which is, kind of, I think, as you're describing, Vanessa, a backbone for success within, whether it's an ACO or value-based care, kind of digging deeper into those collaborations. What challenges have you seen as different providers who haven't necessarily worked together in the past try to come together? And I guess in challenges, I'm thinking, how are they ensuring that the data can be able to flow all around, among all the participants? Because I think you made a very good point and emphasis of saying that you really need good quality data to be able to assess and be able to keep up in real-time data to keep up with the patients. And then, aside from that, and I guess a second component to the question, to maybe be a little unfair of piling things onto you, is, given that the healthcare industry has been very siloed in the past, what resistance have you seen from the establishment of these collaborations?
Yeah, very good questions. I will take them kind of one at a time, Matt, and kind of go through them. So just first to start with kind of the challenges and like that enable collaboration, or that have perhaps in the past been challenges to collaboration. So certainly, there have been different payment incentives in place. In the past, collaboration wasn't incentivized. So that's certainly a very big barrier. And I think, other challenges is just not having the technology to really provide, and to your point, really real-time information in terms of where patients are going, where they're moving to across the continuum, which is really kind of what we're trying to help solve with a lot of other people at PatientPing. But really also having like easy ways to communicate and having staff focused on the transitions. I think all of that has been a challenge over time. And, in the past also not necessarily being conscious about how much disjointed care may be impacting outcomes of patients, that all has come to the fore with additional data and really knowing kind of how well patients actually do, having these quality metrics aligned and sort of associated with kind of population health, kind of as that has grown over this last several years. So in terms of, I think you were asking also about kind of the data challenges that might be out there. And so certainly we don't really have kind of this one technology panacea right now. EHRs are great. They can enable a comprehensive record for a patient at a particular provider setting, but it's not necessarily accessible across the continuum of care, and you miss, obviously, then critical information. There are hundreds of different EHRs out there, and they don't necessarily talk to each other. So it maintains kind of these silos, making it really challenging for providers to collaborate just across those platforms. So, as a way to kind of get beyond that, we have HIEs set up that have been trying to aggregate data, across all of the provider settings, or, maybe starting with hospitals first, maybe branching into some of the post-acute data. And so that's definitely a needed first step, just a way to like aggregate that and to get out of the EHR or EMR silo. But then, that's not enough, because the data then also needs to be shared in like a very easily consumable way and an actionable way, because just kind of dumping data on people, by people, I mean providers, is really not an effective way, because they already have so much to do. There's so much noise. There's so much information overload. They really need to hone in on really what's important, really where they can make an impact. And so that's really the challenge. And it's really something, that PatientPing and many others are trying to solve. Really, we're trying to build ways to remove those barriers, to really give you that information that can be used at the point of care to really make decisions and know kind of exactly what's going on with that patient. So really kind of taking the aggregation of the data one step further and making it into a very easily consumable piece of information that everybody can use, and that really helps kind of encourage that collaboration more so. There's a lot, there are many, many more steps to take, lots more to do across kind of the entire spectrum. But certainly I think kind of over time we're moving there and are certainly trying to get there as quickly as possible.
And then the point, sorry, go ahead.
I think you just had asked something about resistance as well, perhaps across providers. And I don't know if you wanted me to address that or not, but feel free to ask a different question, of course.
No, and actually, I think that's a fair point. Is you're right that one of the initial many elements of that question that I put out was, have you seen resistance? Because I think there's, even though the industry is moving in the direction of value-based care and alternative payment models, there's still a very large entrenchment of fee-for-service, and kind of the encouragement to maintain your fiefdom, to arguably where you want to maintain control over your little piece to make sure you're getting what you can for the reimbursement. So kind of given those dual systems that are clearly still in place, since we haven't gone fully out of fee-for-service, how does that impact the collaboration?
Yeah, it is a challenge. I would say, and don't envy sort of providers that are kind of one step in value-based care or 1 foot in value-based care, 1 foot in kind of fee-for-service. It's challenging to manage in both, and I think there's certainly kind of, at least kind of from the people that I'm talking to, kind of a push to just jump all the way and kind of to set up systems to be successful in value-based care and kind of manage in fee-for-service for now. But really, I mean, the trend is really just moving more and more over to value-based care. And, as you can see kind of by the new models that are coming out from CMS, whether that's like the new MSSP proposed rule or BPCI Advanced that just started a few days ago, or whether it's like that RFI that CMS released around interoperability and making that a part of the conditions of participation. Really significant kind of, I think, tea leaves and kind of systems that are and regulations that are in place to push more to value-based care. So I think I can understand kind of the resistance and sort of wanting to operate in the kind of old system, because that's what you've always done. It's, guaranteed money. It's kind of where things have been. But, I think more and more providers, not just kind of the front end, pioneers kind of ahead of the spear ones, are just moving their entire systems to be able to accommodate and to operate within value-based care, because it's the wave of the future. And if you're not able to, over time, you'll be losing out, whether that's on, penalties on the payments that you're getting, and, that transferring over now to SNF 2 with a readmission penalty. I think overall, the trend is just kind of set and will move even more rapidly in the future. And people will, over time, I hope, kind of overcome the resistance and will operate just under that new model.
And to the comment that you just made about there being a lot of movement from CMS in terms of requests for information, or actually just flat out policy or regulatory proposals, is there a particular change or modification to existing regulations, or a new regulation that you would like to see put into place that would help with the development and progress to full value-based care?
Good question. Good follow-up here. I mean, I think like with the new, MSSP regulations, it's very clear that the administration is trying to, or that CMS is trying to move more rapidly towards a two-sided risk model where the providers and the ACOs in this case, take on more risk more rapidly, really forcing participants into a world where there's skin in the game. And whenever there is skin in the game, as some of the data has shown and the release studies have shown, there will be ACOs do better, by better meaning like they achieve more savings and can kind of more rapidly and in a more focused way kind of implement the new systems that they need to have in place. And I think these, the other, as I was mentioning earlier, the RFI that came out, and certainly nothing is set in stone, but the push towards more interoperability, I think is a good one. I want to see that kind of continue on and really be solidified, because it would really maybe rip the Band-Aid off a little bit and kind of just push things a little bit faster in terms of really making substantial changes across the provider setting to move into more value-based care. I understand, don't want to minimize all of the challenges and, costs and structural changes that are necessary to make that happen. Certainly don't want to minimize that, and it's going to be potentially more growing pains along the way, but I personally think it's the right direction to go, and it's what I would want to see more of and more sort of codified into regulations, not just having kind of an RFI.
No, and actually that is a perfect setup, because as we're unbelievably almost already at the end of our time, the last question I want to kind of pose to you is, how do you see the healthcare delivery system, like what do you see the state of the healthcare delivery system being in, say, 5 years from now?
Oh, I love that question, Matt. It's great. So I guess looking into the future, I think just from a patient perspective, I hope and think that there will be just a lot more transparency, both on pricing and quality, really kind of healthcare moving towards what other industries are doing, giving kind of the consumer, the patient, a lot more information so they can make informed decisions about the type of care that they're getting and when and how and where and how much it is. Healthcare is just all the time, I feel, like a black hole. You don't know really what you're going to get, how much it's going to cost. And I think transparency will be a big thing that's moving forward. I think there'll be, less silos, hopefully much easier for your information sharing, going kind of back to that interoperability point from earlier, just trying to have the barriers or kind of the walls break down more. I think you'll see that. I think probably also healthcare will kind of come more to the patient, having kind of more of a consumer mindset, whether that's telehealth or telemonitoring or, just providing services kind of where the patient is rather than patient having to go to a particular place. I'm sure there'll be, go ahead.
Oh, no, I was going to say, I think that's already a lot of different predictions, and I do hope that we do see a lot. And I think we've seen kind of the seeds for that, and hopefully it will continue to grow. And I suspect you could keep going on with an extremely long list, but unfortunately we are out of time. So Vanessa, I want to thank you so much for a great conversation today.
Absolutely, Matt. I really enjoyed it. And thank you so much for your time. It was great to talk to you.
And thank you to everyone listening. Keep the dialogue going and connect with me at #HCDEJURE. I'm Matt Fisher. Until next time.